Right, let's make a start. Good afternoon, everybody. My name's Jane from People's Powerhouse. Welcome to our latest edition of the Community Wales webinar series. Today, we're delighted to join Candice Randall, who is going to be talking about prevention, not cure, rebuilding a community from the ground up. She is basically the CEO of 3 separate organisations in and around the northeast of the country, and we're really looking forward to hearing about what she's got to say, what she's doing, hints and tips about how other people can follow and do some really excellent work in local communities. Today's going to be a slightly different webinar. It's going to be a different tactic. This time, Candice is going to present to us a lot of the stuff she wants to talk about. So I'm not going to bore you with a long introduction. I'm not going to give you rules and regulations and whatnot. All I'm going to simply say is, in the chat, introduce yourself, say who you are, where you're from. And for the Q&A section, can you please write in any questions you may have? And please upvote the questions that are most important to you, or the ones you feel that we would really need to listen to. I will ensure that we can incorporate as many, if not all, questions as possible throughout this conversation. So without further ado, I'm going to pass over to Candice. Candice, it's all yours.
Hello, thank you so much, James and Rima, for this opportunity. This is very, very new to me and out of my comfort zone, but I'm always going on about that's where all the growth and magic happens. So we're just gonna go for it today. I can see a familiar face there. So hello, Janie. Thank you for your support. Hello, sweetheart. Okay, so I am gonna continue to look at my second screen because I am full on perimenopausal brain fog and will forget my own name at some point during this presentation. So let's get started. James, if you can click to the next slide for me, please. Okay, so over the course of the next hour, I'd really appreciate any interaction, engagement from you guys. So feel free to drop questions and comments as we go. After a brief introduction, I'd like to discuss what I feel is the current problem or problems that we face in the third sector right now. Before we move on to look at the topic of prevention, which I'm sure we could all spend about an hour on its own, but we'll move forward and look at community infrastructure, current systems and the barriers in place, and then discuss what we feel is the real engine of social change before we do a little review. I know James and I have been talking about the work of Cormac Russell, and I'll be mentioning his name throughout the next hour. But I just had this brainwave after James sort of talked me into doing this one about 2 days ago. I had a brainwave of, oh, this could be part 1, and let's do part 2 and look at how the ABCD principles of Cormac Russell could be developed and used and discussed at a community level. So if this one goes well and the feedback is positive, then you never know, there might be a part 2, but I feel like I'm signing myself up for something that, another plate to spin here. James, if we can move on to the next slide, please.
I'm happy to be your Chris Whitty.
Thank you. We have gone back to COVID times, haven't we? Okay, so a little bit about me. I did allude to the fact that I am fully perimenopausal, and I am proud of that fact. I make sure everybody knows it, because for all the other women out there, we all know what that means. It means that we are fighting more fires and spinning more plates than usual at the moment. And I actually think that's a really...
cards and none of them.
Oh, somebody told me. I think that's a really important statement, because for many, many years, we were sort of discussed as women of a certain age and put into a little box. And now this is our superpower. So this is me using the perimenopausal superpower to come before you all today. What it does mean is that I do forget things, which is why I'm reading my notes. I am a mother of 1, a wife, a people pleaser, a high achiever, an avid list writer, and probably most importantly, a plate spinner. And it's why I am able to run 3 businesses and a bit of a side hustle and another little project, because I spin those plates. And again, I think that's because of the way my brain works. It allows me to do that. I do come from a retail management background, so I haven't always been in the third sector. But I did leave quite a promising career there, because I just felt it wasn't enough, that just the sales aspect and the taking from people and not really giving anything of any value back, it didn't really fit well with me. And after a few years there, I thought, no, there must be more to life than this. So whilst my son was young and working full time, I retrained and went and did my degree and thought, right, I'm going to go into education. I want to impact the lives of young people in a really positive way. And it was after a very short space of time, I'll be honest, that I realised that I couldn't quite affect the change that I wanted because the system was too prescriptive. And we'll maybe come back to that again when we talk about the voluntary sector. So I wanted to get away from the money and the KPIs and the stats and make an impact at a real human level. But the education and training sector was too prescriptive, it was too regimented, and I wasn't able to make that change. So I thought, right, well, that hasn't worked out. What's the next stage? And it was at that point that an opportunity arose for me to set up a not-for-profit to support young people in the community. So we bit the bullet, so to speak, myself and my business partner. We did that, and we ran that for a year before business 2 came up, and that was to run into the community centre, to set up the community centre and to save that. So we did that, and that went on, and we thought, well, why not? This is great. We kept going, and that was 7 years ago since that. And then in autumn of last year, I was given the opportunity to take on a third community organisation, and that's an adult recovery service, a substance recovery service. So once again, I said, well, why not? Okay, let's do that. And so we started spinning that plate too. So they keep me very busy, but that suits my brain. So that's a little bit about me and my experience and what brought me to this stage. So if we discuss why the topic matters, so why community is so important and the support that we give others, if that's okay for me to just keep going. For me, it was post-COVID, I noticed a real shift in community support. So, you know, us community workers on the front, we were all applauded on the doorsteps alongside the amazing NHS workers, of which my husband is one, to keep the community going. You know, we were open right the way through, and we adapted our services so that we could provide that community service from the community centre point of view. We came out of COVID, and I noticed less funding available. Many funders that we were using used their funds from investments to support their philanthropy, and that was impacted in a negative way. So there was less money out there, but there were more small organisations popping up. Everybody wanted to be part of this community, getting the community back on its feet. So from our perspective, certainly what I noticed in the areas where we operate, there was less money, but more people asking for it. So that put a real strain on the organisations out there. However, we did come out of COVID in a strong position, because during COVID being so prevalent and being visible to the community, really being out there and reacting to the community needs, it did a lot of good for us on a reputational level. So we came out of that well, but we didn't wait for people to find us. We went out there and found the people. We made sure they knew that we were there. We didn't rely on them finding us. So much so that 7 years down the line, you know, COVID may seem like a distant memory away, but it's the impact of it is still there, especially within the young people that we support. But we're now at a stage where we're turning people away. I hate to admit it, but we are turning people away in terms of the services for room hires and things like that. But because you don't have the space, we're at capacity pretty much with what we can offer there. That is because, and this is one of my real key points that I want to discuss, I genuinely believe that community organisations can only succeed and survive and thrive if they are run as a business. And I know this is something that James and I have talked about, that we see the goodwill of volunteers and community groups, but quite often they don't necessarily have the organisational or the business skills to navigate the systems in place, the bureaucracy. We're not all able to break down the barriers because of those skills perhaps not quite being there. Volunteering we're going to have a little chat about volunteering, about how we should be about restructuring the systems to the skills of the community, that capacity, not squeezing round pegs into square holes and exploiting unpaid labour. And I know that's something that Cormac Russell is passionate about. So the aim of today's session, I hope that we can explore why prevention and not crisis response is the real engine of social change and what it actually takes to rebuild community infrastructure from the ground up over. Does anybody have any questions or anything that we need to look at this point? Super, let's keep going. So I've put in a few images there of business number one. So that's us at AIM North East. So all of our teams are small but mighty, and that's because we don't work that Monday to Friday 9 to 5. We are self-employed, and I think when you have that passion, you do go above and beyond. And each of us probably does the work of 2 or 3 people if we were in the private sector, which is why we are such good value for money. But it's also why we're all burnt out, which we'll come on to talk about, and hopefully people can share about. But this is also
stop. It's fine if you need to come out.
Smashing. Let's keep going, James, if we can move on to the next slide.
Of course. So for this one, this is the only slide I'm going to interject with, Candice, and this is because what we do on a day-to-day basis, we do local listening activities all across the North, where our job is basically to speak to everyday people about their everyday lives and identifying what is it that's happening in people's lives across the North. So there are 2 really important and really interesting quotes that really came out here that spoke to this slide, in my opinion, when Candice shared it with me. And so the first one came from Chester in October, and somebody said basically that people could make the change. I feel as though we need early interventions in communities, and it feels we're reactive rather than proactive. And in Scarborough, in February this year, somebody said a lot of the town centre properties are owned by private landlords, so rents are really in their control rates. Generally, it requires government intervention, so it is very difficult to actively do anything about that. We can lobby, and we do, but it always gets raised and it's always an issue. So these are 2 sort of points that are brought out by the public on a day-to-day, off-the-cuff, something that's affecting people's lives. And this is a great example of why, what we all do, what we do. So Candice can now explain what that all means.
Thank you, James. Yeah, they're 2 really, really good examples. And I mean, I'm sure we could repeat those examples 1,000 times over across the country, because it feels to me like we're all saying the same thing, but then we're not getting the answers that we want or that we need, and that we're all facing the same struggles no matter where we are. So we've got Chester, Scarborough, I'm up in Northumberland. It's a nationwide battle that we're all facing. So I've picked up on 3 points here, and I'd be keen to see what everyone else thinks. But the funding. So I run 2 not-for-profits and a CIC. The CIC not so much, because we can earn a private income stream, but certainly from the community projects, the current models that are available in terms of funding reward action and not prevention. So like the comment that the quote there that you've made from Chester, James, it is reactive. We're reacting to the project criteria. So, we all get funding bulletins and we go through and go, oh yeah, we can make an application based on that, or oh, I could probably create a project based around that. But it's almost that the funding is dictating to us what we can and can't provide, as opposed to us going to a funder with a very open mind and saying, okay, we'd like to do this area needs this, can we have some money for that? The short-term projects aren't supportive of sustainability. So when you've got a project that has to be completed in 6 months or by the end of the year, or you get a 12-month funding, well, you start something and that's great. You build up the relationships, you put all of the work into that project, and then it comes to an end. And what happens then? You file your grant monitoring, but what happens to the people? That it's the people that matter. So the experience of those individuals, now it just comes to an end. Whatever support it is, it just stops. So that's not fair. And then we've got that red tape, that bureaucracy, waiting for intervention to be recognised at government level before it trickles all the way down to us through these small little funds. And I see funds being advertised for £500, £1,000, £5,000, and even £10,000 when you look at the increases in minimum wage and outgoing costs. it doesn't really get you anything now. So all of these little £10,000, you need lots of those to be able to make one project, let alone core costs of staffing and building costs and things like that. Nobody wants to help you pay your gas and electric bills because that's not very sexy, that's not very interesting. But actually, without the gas and electric bill, we haven't got the building to house all of the other activities. So it's this perpetuating cycle of constantly chasing our tails, looking for little bits of money from here, there and everywhere. And then once again, like the comment says, it's prevention. It's not looking at the prevention. It's looking at I wouldn't even say it's cure. It's not prevention or cure because it's not even a plaster. It's like a plaster on a wet skin. It's only there for a short time and then it's going to come off. So that leads us into this crisis culture that we seem to be working with, because we are responding to issues at crisis points. Things have to get so bad before they are acknowledged at a wider level. Then it takes time to trickle back down to us. So for me, the cost of living and mental health being the two main issues that we face daily in my little slice of Northumberland. Again, I'm really keen to find out if anybody's got any other examples of that, but I would just like to share one if that's okay. I know I'm going on. Please, somebody ask a question. Don't let it be me all the time, but I do just want to share one example. I recently visited HMP Northumberland, which is a very large prison in Northumberland. It's been there for many years. And I was there to talk about veterans specifically, but we had the guided tour and we were walking around and we were looking at all these amazing projects that they're doing, and that was great. And then the deputy governor, as I think he was called, was very proud to show us this great big structure that was being developed, and look at all the workmen, and you know, this is going to house 480 beds. I was like, right, okay. So I asked how many millions that is costing, and he didn't quite know, but I was like, right, okay, well, let's just say a lot. And how many millions will it cost to run and maintain and staff, and then the additional education and training and additional catering and cleaning and all of those additional costs for these 480 beds is a vast sum of money, no matter which way we look at it. And you know, we were going around the guided tour, and I couldn't help but make the point that if that money, if those millions had been invested in another way, perhaps we wouldn't need those 480 beds. So for me, I would have liked to have seen 50% of that, let's say 100 million. It could be 200 million, I don't know, but let's say 100 million because it's a nice big round number. If half of that money had been invested in the probation service, which I know from my experiences of supporting probation workers through placements is broken, and half of that money was invested in community mental health. And I know we've got at least one social prescriber on here today, so I'm hoping you guys will agree. If that money was invested in those aspects, then we probably wouldn't need the 480 extra beds that this guy was so proud to be developing at their prison site, because so many of the people that we deal with are impacted by mental health, which has a knock-on effect on their place in society and how they feel, you know, their own agency, and end up, you know, in prison for one reason or another. And I know that's, you know, it's not an excuse and not everybody goes down that route, but I've seen people when they're at the absolutely most vulnerable. And I do think that that is part of the problem. I'd be very, very keen to hear if anybody else has any examples or how they feel about that and about community mental health in their own area.
That's an excellent question, and it does make me wonder, you know, why does it need to be to this level where 480 beds are created rather than money being spent elsewhere, or authorities and institutions not already having things in place to have this already solved? So, you know, why does it take social entrepreneurs and CICs, etc., to actually fill this gap that's been created by a system that isn't clearly working? So yeah, as you said, Candice, if anyone has any questions relating to that, only got any examples of where this is happening either the same way or hopefully differently in their area, please do share, because it'd be really interesting to know. We do have one hand up. So Frankie Proctor, if you want to take yourself off mute, you're more than welcome to talk.
Hi everyone, my name is Frankie. I work for the Greater Manchester Alternative Provider Collaborative. So we represent within NHS architecture social businesses that are contracted to provide NHS services. A lot of the things you have just described there, though, remain the same in our part of the world as well. There's still this short-term contracts instead of small grants and all that kind of stuff. And something we talk about a lot is, well, when we talk about funding, I think we need to consider getting better at not calling ourselves the voluntary sector because of the implications around, you know, quality and price, really, if I'm completely honest. And so we always talk about social businesses in our part of the world. And this is a constant headache and I haven't got the answers, but I think what we could all do better is sort of finding the headspace, time, capacity to sort of model what happens if our services don't exist, which is sort of what you've just made reference to with the 400 beds in the prison, isn't it? Really, is, you know, we sort of need to get better at, I don't know how we do it because we're all too busy, you know, barely got time to look up and all the rest of it, but I think it'd, you know, really help this argument if we were able to sort of develop linkage between, you know, our activity and what's happening further down the line.
Thank you for that, Frankie. I appreciate it. Are there any other comments people would like to make? I can see some comments flashing up on my screen, but because of the way I've got this set up, I can't actually read them very quickly and very easily. So if anyone would like to also put their hand up and join in this conversation, you're more than welcome to. Alternatively, I do have Rima helping me out behind the scenes, who tells me that Jamie said the following. She said that as a comment more than a question, in her experience, ex-offenders really struggle to be accepted back into society and they feel stigmatized and rejected. So it's often a simple return back to old ways because they're shut out of moving on. Melissa Taylor totally agrees with this, that money should be shifted to prevention. But the challenge is, how do we do this when we can't just stop the funding when we can't just stop funding the acute care? So thank you for these thoughts. Is there anything you'd like to take up there, Candice, or would you like to just say, yeah, I agree with all that and move on?
Yeah, no, absolutely. If you wouldn't mind, Frankie, that was fantastic. Yeah, absolutely. I love the idea of calling them social businesses. I've never heard of that expression. It's not something I've ever heard up here, but I've written it down because I am absolutely going to take that forward. I tend to call it the third sector, but then nobody knows what that means either. So yeah, I'm going to use that, social business. I'm going to take that and I shall reference you the next time I use it. So thank you very much for that. The comment about people reintegrating into society. So yes, there's reintegrating into society in terms of coming out of prison that way, but even just integrating into society, that social isolation, that we see day in and day out because people aren't connected in a digital way, and we are sort of kind of being forced to force that onto people. You know, we don't have advertising budgets. We can't put flyers through everyone's door to let them know all the great work we're doing. So the only way we can get the word out is by using social media and digital technologies. And so we miss a lot of the people who need us most using that. The mental health, I'm going to come back to again. I am not a mental health professional. I've never worked, in mental health, except that I support people with it every single day in a very informal way, I suppose. However, I do know, like you say, Frankie, that if it wasn't for, I'll use business number 2, I'll use Bridal House as the community centre as the main one, because that takes up most of my time. If it wasn't for that, I know that the community that we serve would be in a much poorer state. Trying to put that down in a 500-word, tell us about your organisation funding application is just impossible. I have a copy and paste document which describes us saying 250 words, 500 words, 1,000 words, because once you get it down to that 500 words, trying to duplicate that and do it again is nearly impossible. So to be able to say, yeah, this is the 500-word version of what we do, but you can't really, you have to use umbrella terms because you can't give the detail of how valuable community services are in such ridiculously short periods of space. You know, it's crazy. So no, thank you for that. I'm going to take that. The mental health coming out of prison. Well, mental health services in prison don't exist, or certainly doesn't exist in HMP Northumberland, which is a really large prison. There is no mental health service in there. For veterans, I was surprised because I thought, well, surely there'll be extra funding for that, but there wasn't. But no mental health service. So these people are being evacuated from prison and being made homeless because they're not allowed to register on any local home finders or with any local housing provisions until they have left. And by that stage, they're already homeless. So I always use Maslow's hierarchy of needs for anybody who comes from, maybe perhaps an education background. We're not even providing the absolute basic. We can't provide a safe place for them to sleep. So how do we expect them to contribute and sort of reintegrate into society? So yeah, I get on my soapbox about that one, as you can tell, so I do apologise. We better move to the next slide, James, otherwise I'll have you here all day.
Not a problem. Well, it ties in perfectly, because I can see the next slide. It ties in perfectly what Melissa Taylor was suggesting when talking about how many must be shifted to prevention. So how do we go about doing that? So let's find out, Candice.
Okay, so prevention. Let's have a look. So obviously the bottom tier is quite obvious, right? So, reducing the longer term costs and reduce trauma escalation. We build resilience rather than dependency, which again links to Cormac Russell. We see the results of stronger, more cohesive, inclusive, engaging spaces. All these little key words that you want to use in a funding application, but they're absolutely true. We build trust and we build positive reputations and become organisations that are name dropped and then become the organisation that people refer to. By proactively assessing the needs of the community, we use stats to support our argument, demonstrate the need. We have to be everything to everyone to be able to be recognised as a strong community player, somebody that can attract funding. And this is an example of Cormac Russell's, the ABCD theory, the asset-based community development, which I'd love to talk more about another time. So when we focus on community-led change through the inclusive participation, relationship-driven work, the emphasis is on the people and not the service. And that's when we have the real power to become, when we become people-driven, we're not reactive then, we are being proactive because we already know the issues. We're not just providing services based on what funding is available. The result for me, I've written overworked and underpaid. Yes, absolutely. I'm sure a lot of you are nodding along and smiling at that. But we do become those individuals within a community who make life better, make spaces safer, and make communities more than just buildings. It really is that human contact for me that is at the heart of everything. James, if we can just pop onto the next slide, I think we can.
Of course.
Move on. This is something that I'm really passionate about. I alluded to it at the beginning, that community cannot rely on goodwill alone. So there is an element of we do need the funding, whether we can do a little bit of income generation ourselves or not. We need the funding, so we need that institutional support, but it has to be a blended process of us needing them and them needing us. And like Frankie said, I don't think they realise how much they need community organisations such as ourselves until we're not there, and then they realised how much we would do, we were actually doing. But if it's not financially stable, it can't survive long enough to create lasting change, which is why we have lots of small organisations popping up and then going, and then popping up and then going. I'm going to use my own example of blended funding from the community centre as an example, because I run it as a business, but with the community at its heart. So every decision I make, the community is at the heart of that, but it is still run as a business. We currently operate on a 60-40 split, so 60% of our income is self-generated, so that's through hiring the space out, long-term lease agreements, our on-site cafe, we do Meals on Wheels, fundraising, 60%. And I was working towards 70, but then cost of living kicked in. So if I can maintain the 60-40, then that's something. And it really has proved that funders appreciate that, and they can see we're working hard to generate our own income. And it means that the more I earn, the less I have to ask for, basically. We've got about 10 active volunteers across all departments, so that's office, kitchen, specific groups, outdoor space. And I absolutely value their contribution 100%. I couldn't do it without them. However, I do know, and I completely understand, that if they get a better offer, so if their family offers to take them out for an afternoon tea or something like that, then they're going to go. So I do need paid staff that I can rely on and hold accountable for the operational elements of our project. Our services support a massive range of people, like literally birth to 98 and everyone in between, and so that's too valuable to lose. So we need to have plans in place. I think that element of not relying on the volunteers is really important, because that's when we see the burnout. You know, I'm burning out and I get paid for it, but I get paid for it, so I can't just go, I'm not going in today, I'm too tired. We keep going. It's really important that we focus on that project sustainability. This is where we need the institutional support, because as we've said, the short-term funding cycles don't support that. The collaboration element, I want a little chat about. I'm not sure if anybody else runs multiple projects. So for all of my 3 projects, focus on 3 entirely different groups. We have young people, wider community, and then the recovery community. There are blended lines across all of them, and it's that human connection. So whilst I am the link of those 3 organisations, it's that human contact element that brings them all together. So ultimately, each one is supporting people, and when you bring the core of supporting people to it, it's that empathetic nature of all of the teams. It's not just me. We all work together to do whatever we can, and we bend over backwards to make sure we can support all of those people. So that those blended lines are absolutely crucial.
It's interesting because Broadbridge has literally just said it's like stitching together a patchwork quilt of funding often, and that kind of does sum up where we're at, doesn't it?
Yeah, absolutely, yeah. And you know, whilst you've got one funder who might offer you £10,000 for this, and then a different one 10 for that, but they kind of come under the same umbrella, so you're applying for both to get to the one project. But that is a lot of work. That is a lot of work, and it's a never-ending process. You know, you guys will all be the same. You know, sitting out there making a fund, and you get it, and you think, yes, brilliant, yeah, we've got that for a year. But within a couple of months, you need to start looking to replace that. So it's a constant cycle of where is this money coming from? Who can I get it from next? Probably
brings us on to, sorry to interrupt you. There's one extra question that's come in, and it's this one. Is the way in which things are funded and the way in which people are involved in finding solutions, is that the problem? What should a conversation look like with commissioners and funders in an ideal world? You know, how could we make this work better for this? I was going to call it the third sector, but I'm scared to call it that now.
No, it's the social businesses now too. It's a really good question, and you know what? It's going to need more social business leaders to be in the room when they're having these conversations about how much money gets divvied into which pot and which area has it. And I don't think it is. So it's very easy for me, and I may be entirely wrong. I'm happy to be proved wrong. But how many of the people who decide which pot of millions gets spent in which sector has actually ever been to any of these places? They've never been to me. I just apply for the funding. You know, do they really know what it's like on the ground? Who are they listening to get that information? And then where in the pecking order are they? So are they taking their information from this tier of people? And I hate to use the tier system and make it sound like we're bottom of the pecking order, but when it comes to things like funding, we are, because we are the ones who are applying for the funding and getting the grants and doing the work. Where does that information come from? How many rungs above the ladder does that stop before actually feeds down to us?
Exactly right. Anything else to add there, Candice, before we go to the next slide?
No, feel free to jump on because I'm conscious of time.
Oh, we're good for time, don't worry about that.
Okay. I've just on the next slide, I've just thrown in some photos of business number 2. So this is Brydale House, so very bright, very wacky. I know some of you will have been there. It is my absolute pride and joy. It really is. Absolute blood, sweat and tears have gone into making this not just a safe space, but it's aesthetically pleasing, it is well kept. I've tried to create something that breaks the mold of what a community centre does, feels like, looks like, everything. It is a passion project. I mean, all of mine are, but if someone had asked me 10 years ago, do you ever think you would be running a community centre, or in 10 years said you will be running a community centre, I would have said, absolutely, don't be silly, that's not even on my radar. But I believe that everything I have done in my former life, so the skills I got from retail management about communication and people leading and being focus driven on sort of the KPI element, then in education and meeting people on a more human level and really looking at what support they need as an individual, that's all brought me to what I've done now. I feel like I've found my purpose, and I feel absolutely privileged to feel like that, because I know people who are in their 60s who still think, well, I never knew what I wanted to do, you know, just went from job to job. So I'm very proud that we've created something that we love so much. I never have a problem getting up for work on a Monday, put it that way.
I can confirm, having visited Rideout House, it is an oasis of calm, of happiness, of safety, and you walk in and it's like, I feel like I'm home here. It is lovely. So congratulations.
I don't know what day
you
said, James. It's not very calm very often. It's normally absolutely bonkers, but it is.
I did come on a Friday afternoon, to be fair. So
yes, Friday. That's our calm time. That is like sleepy time in the nursery. It's chilled out time. I am making an assumption here that everybody who's participating in today's sort of webinar is nobody entered. I was going to say the third sector, but nobody entered this sector, whether that be community or charity work, volunteering or anything. Nobody entered that for the monetary rewards. They didn't see an advert and thought, blimey heck, that looks like a good deal, let's sign up for that. All of that money for hardly any hours. That is not why any of us got into this. I will pause for laughter as we all go, oh yes, that's so, I definitely didn't get into it for that. We chose this route, we chose this sector, we chose these roles and these organisations because we care, we are empaths, and we all want to make our little slice of this world a better place, and we want to help other people. This centre and the people I work with is my little slice. This is my little happy place. I go to there and I know that I'm going to leave and be absolutely exhausted, completely emotionally and mentally drained, but know that every day I've made a positive difference. And I think that's why all of us are here, because we genuinely care. So little pat on the back for everybody. And I know it sounds really cheesy, but it is 100% true. I don't have a problem getting up for work on a Monday, and I do love what I do. So yeah. Next slide, please, James.
I'm scared to go to the next slide now because it's a nice, happy place we're currently in, and I'm worried about what might come next.
This one's not bad. Don't worry. Okay, so looking at the systems that don't work, I think we can all agree that those top-down decision making, that bureaucracy, it impacts us in a negative way. Quite often, we need the guidance, perhaps, and we need to see the national picture. It's very easy for us to just see the local level stuff and not perhaps the bigger picture. But this top-down approach doesn't seem to work. It creates this dependency instead of capability within communities. In my experience, perpetuates a cycle of burnout, stress, and overwhelm, because we've talked about how the pressure of these funding applications and the grant monitoring, and it's often hard to monitor in the way that they want it documented. How can you measure? It's not all about the statistics. What we do, it's that narrative, that narrative approach, these conversations that we have with people on a daily basis, and then trying to document that into graphs and figures isn't always very easy and doesn't always look as impactful. I have real concern that if left to spiral further, we're going to see the loss and certainly the reduction of community-led organisations at a time when formal support methods like GP appointments, talk and therapies, and we go back again to community mental health, when that is getting more difficult to access, and therefore our services are needed more. It's at a time when community organisations are also feeling the pinch because of things like increases in wages and utility bills going up, and the price of petrol on cars, and trying to support staff and keep organisations such as this going at the same time is a real struggle. And that falls to those of you who are in the same position as me. It's my job to keep this ship afloat, and I steer this ship, and the water seems to be getting choppier and choppier every time we get through one wave and we calm down, and then another storm comes, and I have to captain that ship through the hard times, but make sure that nobody's falling off the boat at the back at the same. It's not easy. So how do we work around these barriers? For me, it's all about the local partnerships, and that can be through informal networks, just bringing communities together, working with other community organisations. I'm all about collaboration, not competition. There are more than enough people out there that need help. So the more organisations that are there to join in with that, the better. Building trust and building up the company reputation, your organisational reputation, but your own reputation as well will precede you. And that isn't quick. It's not a quick process, but it lays a strong foundation. And from that strong foundation, the growth potential for people coming to you and to say, look, I've got this money, can you do anything with that? That is where we can really make a positive difference. People start coming to us and saying, I've got £20,000, can you do something with it? And I'm like, yes, I can. Yeah, I'll do it. Yeah, I can take all your money, spend it as much as you think. Breaking stereotypes, I think, is really important when we talk about, and that's the point that Frankie mentioned about when you say the voluntary sector. It's like if we have a fitness class as an example and we've tried to do it free of charge, people don't see the value in it and so don't sign up. But if I charge a couple of pounds, people feel like they're getting better value for money. So it's breaking the stereotypes around the voluntary sector, the third sector. So social business is the way forward, people. We have carved out our USP with each of the organisations. I'm really focused on making sure we carve out a brand, and so I've put some examples there at Bridal House. We are a really bright, aesthetically pleasing. There's always music playing. It smells lovely. It's not a sterile environment when you walk in, and it puts people at ease. So I'm wondering if that's something that other people have focused on. You know, the first visual impression of their group, their centre, how they present their offer. I'm sort of wondering what that dynamic looks like elsewhere, breaking stereotypes. I don't know if anybody's got anything that they think, yep, I can verify that that's what we do, or comment on that. If not, James, I'm happy to move on.
It sounds like we're moving on, looking around.
Go for it. So, key points to finish. We're doing good on time here. So, prevention is more effective than a crisis response. I doubt very much whether anybody would argue that one. Systems alone cannot solve problems rooted in human connection. And for me, the human connection is the most important point. And then trusted local networks create the real change, and that is through that human connection. It is through those conversations that we're having with other organisations and residents and local professionals, healthcare professionals. That is where the magic happens for me. And I think that is me done. If we move on to the next slide, I've just got my contact information there. If anybody wants to email me or discuss anything further, or share any examples, or share any ideas, please feel free. I've put 3 email addresses on there, one for each organisation. So Community Centre Life at Bridal House. AIM North East is the not-for-profit I run that supports young people 16 to 24. And then the latest one, Full Circle Recovery, that is the adult substance recovery organisation that I run as well. So please feel free to get in touch about anything. That's absolutely. And that's it. That's me done with 2 minutes to spare.
Let me stop presenting. Well, that was wonderful. Thank you very much, Candice. Really, really appreciated that. Gonna change things up slightly because we have, what have we got? We've got just about 10 minutes to go, and it's Friday afternoon. Everyone's probably thinking about the weekend and going to bed or whatever it is they want to do at the weekend. But does anyone have a question? Does anyone would like to come into the conversation and give their thoughts or ideas about what's happening in their world and what they feel as though what they've learned today, is there anything we disagree with that Candice has said? Have you been inspired by anything? Is there something we should all be doing? And yeah, as Rima says in the chat, feel free to turn your cameras on. We can just have a little chat here now. Be happy to take as many questions as possible, and we'll just open up to the floor. So I see Frankie's there first, so let's go.
Me again, sorry. I've just been reflecting on what an important part of prevention listening is, in terms of I can think of so many examples of people who have ended up in crisis because they weren't listened to earlier on in the pathway. And I'd just be really interested to hear people's your take, Candice, and others, on how we can sort of champion that culture a bit more, because I think people are often, professionals, medical or otherwise, often know better than an individual, don't they, about what's good for them and that kind of stuff. And I'm just interested in what we can do to sort of get the system to better listen to people at an earlier point in their journey, in order to prevent them ending up in these crisis situations that we would all like to avoid.
No, it's an interesting point, isn't it? And it's, has the system been designed and developed to deal with the outcome rather than the actual problem in the first place? And it feels more and more as if it's a much easier job to deal with to put a plaster on something, as Candice said, rather than actually dealing with the problem at its core. And we're finding the funding to actually look at these issues from the core are not easy to come by. They've got a lot of blood, sweat, and tears. And there's a lot in that, isn't there? Why is this such a challenge? Why is it such a difficulty to do something that people do this because they're passionate about wanting to make change. They're not doing it because they're paid to do it as such. And it's a quite sad but enlightening conversation. Rima.
Thanks, James. I think that we need to get to a place where the listening becomes a part of normal practice, where we embed it actually at a fundamental level, pre-funding being actually given, so that in every funding package there needs to be an element that both the funder expects in terms of deep listening and that the delivery organisation expects to be able to do in deep listening. That's kind of how I would love to come to it and be part of that, so that we know we have experts in the field, but there's something about that partnership, of that equitable relationship, isn't there, where if the expert is willing to work with you in partnership, there's something about flattening that playing field, and then real listening can take place. So there are practical considerations around how long an appointment can take with a specialist, for example, and how many people they need to get to see in the day, etc. But I believe fundamentally that's driven by economics, not ethics. So I'd like to see a strong listening model embedded throughout all service delivery, all service design, actually service design before even delivery.
People be listened to. And the rest of you had your hand up early. Would you like to add to the conversation? I'll take you off mute if you do. Oh, you've already done it.
I don't know if because the point there with Rima went on to sort of the funding side, but I come very much from a lived experience background and have worked in mental health. And the point I think was Frankie made earlier about kind of the listening is the important bit. Like, I've never felt my voice has been heard, and I've advocated for my mum, my daughter, my sister, and it really does need to be the place where we start, because I've got quite a big voice. I've got quite a confident. I have been called voracious. Is it vociferous by a SEND teacher? And I said, that's fine. I'll wear that as a badge. Thank you very much. But I don't think, not everybody has the stamina and the resilience. And we shouldn't have to fight to have change. It's really important, because we the people that I know and the people you support, we run out. You know, we only get told so many times that we don't know the answers and we're wrong in what we're saying, and you know, going to GPs, going to specialists, they have expertise but they do not know best. I've just left mental health NHS and worked with a lot of professionals, and I give them a lot of respect. They know their stuff but they don't know best, and like you say, they have a quota to fit into, and an allocated time, and they listen to the individual in front of them, but they don't hear anything. They listen, they hear what they need to tick off for that day, or what they've been taught and what they need to be given. So I think, like you say, the listening, it's real listening, it's active listening, and I think we could save a lot of time in services and save a lot of money if we listened properly at the beginning, rather than wait until somebody's been banging their head against a wall for 5, 10, 15, 20, 30 years.
And that's the same with the current funding model that we've just talked about, isn't it? Because we're only reacting to issues that get to that crisis point before we then react to them. It's very much less than ideal.
No, exactly right. Anya has a question. Would you feel free to open your mic and open your camera and join the conversation?
Hi there. Yeah, thanks. It was a really interesting talk. So I'm from a slightly different background because I work between the NHS and the University of Manchester at the moment, but a lot on like health inequalities research and how we can involve like local communities in it. I think the first thought I had was like how similar some of the challenges in the research sector are to the social business VCSE sector in terms of that short-term funding that's on like a project by project basis, and the funding calls kind of coming from funders, and they decide what the calls are, and they're not always being the scope for like flexibility and doing research in a different way. So I thought it was quite interesting that there are some similarities there. But I was also I think some researchers at least are becoming aware of the value of community organisations and all that you all do, and how that can be a really valuable route to speak to people and involve like lived experience in local communities in research and the idea of co-production and that kind of thing. So myself, and I know other people I work with, are increasingly going to community organisations and asking them to help like recruit for research studies, but also in some places like co-design like research projects and things. And I just wondered, I think research can help with that listening and kind of giving a platform to voices, and then helping with advocacy and also helping community organisations, I guess, helping them say they're involved in research and that helping with them getting grants as well. I can see that that can happen, but I'm also aware that sometimes it's just another task to do, and it can add like a burden to community organisations. And like, yes, researchers can pay for some of the time, but maybe it doesn't capture everything. So I was just wondering, like, yeah, Candice or anyone else, if you've worked with researchers, and how have you found that process, and any thoughts on like how it could be done better?
Yeah, thank you, Anya. Yeah, we have participated and helped gather research participants for several of the Newcastle University research projects. Just, you know, that generic, you have this really great big audience, captive audience, could you get people involved? And we always do, because, you know, I do what I do because I want to try and help people. So I want to try and help the person who sent me that email. So I always do it. But when we talk about, first of all, when we talk about listening, somebody said a little comment just before there in the little chat I saw about deep listening. You know, we're being asked to facilitate a research project on a certain topic that we think, well, okay, we've been saying this for years and now we're starting to research it, blah, blah, blah. We haven't been given any time or resources to do it. We're just doing it to help out and be part of another community initiative. And then, are we really deep listening? You know, we're sending somebody on a survey where they get some ticky boxes and a little bit. I sometimes feel, in my experience, that the outcome has already been decided. We took part in a research project for a big local development, and our views weren't considered. The project was going to go ahead irregardless of what the outcome of that research was. So we stated our case, and I went up to County Hall and was part of a panel that shared views. And when one of the councillors, was talking about how they wanted the quantitative evidence of who we help, and I said, look, I can tell you how many people walk through the door, but you're not interested in the qualitative evidence. You're not interested in the stories because you don't have time to listen to them. I've had to make time to listen to this person in amongst everything else, but you haven't got the time to listen to me sharing that information with you to really make impactful decisions, and the decision is already made. So yes, we do participate in it. Do I use it as part of a funding application? No, I won't say, oh, we've been part of this, that and the other. I'm not saying it is a pain, because I could just say no, I could just delete the email. And I have on some occasions when things are too busy, because we just physically haven't got the time. But, somebody's already deciding what to research. They're not asking us what should we research, and we're at ground level. So there's only so much weight I can put towards those research topics. And my husband is a PhD researcher, so, I know the importance of research. I'm not saying I don't, but at ground level, it's probably not where we're at right now.
Mm-hmm. And I completely get what you're saying about, like, sometimes the question, people only hear what they want to hear or fits that specific research question, so it's easy for things to be like out of scope. So I think they're really important things to reflect on. Thank you.
Thank you.
No, thank you. We have one more hand. I'm conscious of the time. Normally we stick to an hour, but I'm happy to go a bit longer. But if anyone feels as though they need to leave, so I've got a meeting at 3, we won't be offended. But Adeline Keogh, feel free to take yourself off mute and join the conversation.
Thank you. Can you hear me? Because
we can.
Okay. Just about the researchers part, I think, like anything else, it's sometimes depending at the skills of the researcher, because I think sometimes we go into jobs that we think might match us and our skills, but they don't really. So I think in anything community facing and front facing, especially the voluntary sector, if people get jobs that are not really matching their skills and interpersonal skills, people try to do a job and they're not doing the job they were supposed to. And I've seen in my role 4 years working in Blythe alongside Candice and Marissa and James and Rima, sometimes people coming in with the wrong skill set and they completely blow a really good idea and turn it and make the opposite of it. So yeah. And Candice, you're an absolute asset to Blythe, and the way you've done things at Bridal House, working in the community for a few years, I've seen what you've achieved, and honestly, I'm honoured to be able to work alongside you in your endeavour. So thanks for everything you do. Don't. I mean what I said.
I know. Thank you.
Not sure how to follow that, to be honest.
Cut.
Does anyone else have anything else they'd like to add or discuss before we bring an end to this really enjoyable and really interesting webinar? They always say you leave an extra 3 seconds longer than you should do, so I've just done that now. Right, it's been an absolute pleasure to have Candice with us today. Thank you so much, Candice, for the amazing work that you do on a day-to-day, and for the work that you've put into this presentation as well, and for helping us put together basically something that hopefully people will understand, they'll listen, they'll learn from, and they'll be inspired by to continue doing the great work that they're doing across the north, hopefully, and beyond. We have more webinars lined up, so please follow us on our Eventbrite page, People's Powerhouse Eventbrite page. I also send a monthly email to all people that have either been to a webinar previously, so you'll all be involved, and everyone else is on our mailing list with each of the webinars that we're doing on a month-to-month basis. I'm putting the final I's and a final T, crossing the T's and dotting the I's on the next 2 webinars that are going to be in May. So we'll be in a position to announce them hopefully early next week. But as Rima said in the chat, we're very much open to all. So we have had all sorts of different people on this webinar series so far. We started with Cormac Russell and Michael Marmot. We've now If we were to talk about the hierarchies Candice mentioned herself, we've now come to the grassroots. And I think you'll all agree that it's equally valuable, the work that's been discussed at all levels. So we just want to hear from great people doing great work across the North. So if you feel as though you are one of those people, if you want to be involved in that conversation, please get in touch with us. We're people at peoplespowerhouse.org.uk. I'm James at peoplespowerhouse.org.uk. And we'll be happy to do as many of these webinars going forward as we feel as though it actually be a benefit to people. We also have a YouTube channel, so every single webinar that we do goes onto our webinar, goes onto our YouTube page shortly. So they're all there. So if you've missed a webinar we've done previously, you know where to find it. If you enjoyed this so much, you want to see it all again, you'll see it on our YouTube channel within the next week or so. But I'm going to leave it there and say thanks again, Candice and everyone else for joining us. It's been a thoroughly enjoyable hour and 2 minutes, and I hope you've all enjoyed yourselves and have a lovely weekend. Thank you.
Thank you. Thank you, everyone.
Thanks. Bye, everyone.